Governor Jared Polis, 6 months now of a state of emergency with COVID-19. You've signed 178 executive orders, 40 plus individual orders that have been either extended and amended. Are you comfortable signing 40 plus unilateral decisions without the state legislature's input?
Yeah, I appreciate that distinction, Marshall. 177 sounds like a lot. Obviously, it's really 40, but some of them are renewed or changed. Since I have pride of authorship, I would say each one a gem, Marshall. And by the way, when the legislature was back, some of them lead to good permanent change. For instance, suspending rules that got in the way of telemedicine. We did that on a provisional basis. Emergency rule, the legislature put that into law. I signed it. Coloradans will be able to access telemedicine going forward. Takeout of alcohol from restaurants. Emergency order, it started out helping our restaurateurs. They've been hard hit by this. We want them to get by in this new world. That was put into law. I signed it. So they're not all designed to be permanent, but if we can expand sort of freedom and choice and reduce regulations permanently because of this, I'm all for it.
At the beginning of the restrictions in your executive orders, the goal was to prevent hospitals from getting overwhelmed. They've not been overwhelmed for months now. Is that still the goal?
Yeah, it was close in those first few months, Marshall, and we were in April, May. That's why the elective surgeries were suspended for a while. That's all back. We don't want to ever have to do that again. It was very difficult to delay surgeries for people that were expecting them. My father-in-law just had a shoulder surgery today. Those are important for folks. So I think what's important is that we're able to maintain this at a level where we can grow our economy. We're successful in reopening. We save lives and we don't threaten our hospital capacity. And thus far, Coloradans have been doing a great job wearing masks, avoiding large groups, and accomplishing just that.
We're still at 50% capacity for venues or restaurants or places. Schools are mixed of whether they're in person or remote. We've got the capacity limits for indoor and outdoor events, 175 or 500, depending on where you are. Is this as good as it gets until we get a vaccine?
So most schools are back. If you live in a district where they're not back, hopefully they're coming back soon. A couple of the bigger districts are taking a little bit longer just to make sure they have those COVID prevention protocols in place and kids are not exposed to too many other kids. But most of them are back. The rest are coming back in the next few weeks. I visited a number of schools across our state, seeing great work that they're doing. You know, kids that are wearing masks and apart. My kids are back in school. It's as safe as it's going to be during a pandemic. Now, I get that for some families, it's not safe enough. They want to do homeschooling or virtual schooling until this is over. I get that. But for most of us, it's a reasonable risk. I think the kids in so many cases are more at risk not having that kind of environment to grow and learn it.
I guess another way, people just want to see light at the end of the tunnel, knowing that all these executive orders meant something, that this was all worth it in some way. But is there no light until there is that vaccine?
Well, so, you know, with restaurants, they're at half capacity. Many of them are outdoors. Now they're at 100% capacity. Some are 120%. So the challenge we're facing is how do we make sure we're going to have great weather through October, outdoor dining. As you get into November and December, it's a little cold, right? We're Colorado. What do you do to make sure people have that safe outdoor experience if they choose it instead of the indoor experience? Tents, fire pits, space heaters, all of those things. Of course, there's a light at the end of the tunnel for humanity, right? A cure, a vaccine. There's already promising therapies, plasma, remdesivir, reduce hospitalizations, reduce death rates about 20 to 30%. That's good, not a game changer, but it's certainly better to get COVID now than it was 6 months ago. Many more therapies on the way. And then yes, vaccine trials occurring now. I'm optimistic. Maybe it's because I'm an optimistic person, Marshall, but I think of the many different vaccines being tested, we'll have some that are proven safe and effective by November or December. That means distribution early next year in quantities that can make a difference to keep people safe.
If that timeline's not correct and it's longer than that, can we sustain this that long?
Well, look, we hope that that's a timeline. There's a lot of irons in the fire. I think that some of these vaccines are going to work. And I say some, I think there'll hopefully be more than one that works, which is great. And, you know, there might be some that have 70%, 80%, 90% protection. But look, what happens over time is humanity builds increased immunity to this virus. So back in the 1918 pandemic, the last one, right, it hit really hard for that first year. And then over time, people developed immunity and it became less severe. That's what will happen with this one. It'll be with us forever, Marshall. Even with the vaccine, this thing isn't going extinct. It'll be with us forever. But over time, through both immunization and through developed immunity, people will be more and more resistant to it, and there'll be less and less outbreaks over time.
So you referenced in your news conference the 5 counties that are Protect Our Neighbors: Mesa, Gilpin, Rio Blanco, Gunnison, and Moffett. I didn't know until that news conference that could, if they want, those counties can exempt themselves from the statewide mask order from the last call. When is a Front Range metro area county going to get to Protect Our Neighbors?
So we've emphasized from the start local control, and many of the Front Range metro counties have put in restrictions well ahead of the state and beyond where the state restrictions are. So, I mean, they've had masking requirements before the state did, and in many cases they cover more people. The state one is just indoor around other people. Some areas have outdoor requirements. Some areas have a different age requirement for it. But that local control also means that for areas that are ready to move forward faster, we want them to encourage them to do it. So in those 5 counties you indicated, including the city of Grand Junction, if they want to, can have their bars and restaurants serving alcohol till 2 in the morning. They don't need the mask requirement if they don't want it. And also they have a significant more capacity they can have. Why can they do that, Marshall? Not just because we love those areas, but because they've succeeded in reducing the virus to a level and also showing the public health capacity to detect an outbreak early. Talk about the virus for a second. Why is that so important? When you're exposed to the virus, 8 to 10 days to develop symptoms. Another 8 to 10 days till you would need hospitalization if you're in the 10 or 15% that need hospitalization. So that's 20 days from when you're exposed to when you show up in a hospital where we notice you. We don't know you exist if you don't get tested earlier in that process, meaning if you wait till you're in a hospital, probably you spread it to 30 or 40 other people by then. That's too late.
So what are we doing wrong in the Denver metro area that we're not Protect Our Neighbors yet?
Well, I don't think it's what we're doing wrong. I think the Denver metro area is doing better than most metro areas of its size nationally. They are. The mask wearing, the distancing, it's just harder to achieve a level of control because of the large number of people that travel in and out of the metro area from many different areas. I think, of course, over time, as we get into winter, how can restaurants still be at close to 100% capacity? If things are still going well, I'm hopeful that, the last serve for alcohol can go back another hour over time, get back to normal. But with, absent those restrictions, things otherwise are going fine. You can go out to eat and get your hair cut. You can do what you want to do in a reasonably safe way without jeopardizing your own life. And of course, there's many people that are particularly at risk that continue to stay at home, and that's completely understandable, including my parents who are 75.
I mentioned the 178 executive orders. Is there an executive order you or your staff considered that even you thought was, well, this is too far?
Well, look, I like all of the good ones, meaning the ones that increase our freedom and suspend rules and regulations and let people do things they couldn't do, telemedicine, pick up drinks from bars. We did some around delaying when taxes are due. Who wouldn't love that? I mean, it's great to sign something that says you have 3 months or 6 months more to prepare your taxes without penalties. So all of those are great. Obviously, no one likes the ones that I don't like too, which is nobody likes wearing a mask all the time. I don't like it. Our kids don't like it. We do it because we want to stay safe. Nobody likes some of the ones that interfere with things that we love to do. But they're all temporary, and I think out of them can come more opportunity. So we talked about the last serving for alcohol. It's now 11 p.m. Hopefully it'll be midnight at some point soon. But when this is all over, why would we restrict them to 2 a.m.? I mean, let people do it till 4 a.m., 6 a.m. So we're going to recommend to the legislature that they let, areas that want to have a later last call, like 4 a.m. So hopefully that can be a permanent outcome of this, along with the telemedicine, along with some of the other things we're learning along the way that can leave us in a better place.
And I want to end on this high school sports question. I know you're familiar with this email. I'm just going to read you the brief excerpt from the CHASA commissioner from July 10th. That was quoted, it was sent to a couple people in your staff. It says, quote, "I ask if a major decision is being considered that would counter the messaging that I'm sending to the membership and public that your office will give me time to prepare. Whether I would agree with it or not, I would want all optics and subsequent messages to the public and member schools to be supportive of the governor's decision." Last Monday, when you dangled the idea of fall football actually being played in the fall, and then CHASA's board did not vote for that to happen, did you fail CHASA? Did CHASA fail fall athletes in high school?
Look, I think there's probably better communication that could have occurred. I work closely with the executive director of CHASA, Rhonda, does an amazing job, real advocate for youth sports. I think there's a window that some of the sports that want to come back in the fall can come back. I'm optimistic about that. Football, girls field hockey. We're in close communication with CHASA now. Normally, it occurs on its own. It's just something that people take for granted. But right now, you have school districts all over the place. Some that are back, some that aren't back, some where they're not letting people into their gyms, some where they're not even holding classes. I think many districts are ready for more fall sports. We already have fall sports. I went to the very first CHASA fall sports. Was a golf tournament about a month ago, just to wish the kids well and encourage them. And it's great to see sports done in a safe way. They're an important part of what makes our educations worthwhile. And I'm also optimistic that districts will have the opportunity to do even more fall sports this year.
Thank you for the time, Governor.
Thank you, Marshall.